1 year that health is also one of the most important need. These are the different epidemics we have seen for last 100 years, starting from plague and then cholera. In between there was a chikungunya epidemic, H1N1. But all these epidemics basically lasted for a relatively shorter period of time. But if you look at COVID-19, it's a medical phenomenon. It has gone into COVID-19 crisis. And really, we have seen that it is a national healthcare emergency in India. And according to me, even it is a global healthcare emergency where the patients are loaded, hospitals are flooded, doctor scarcity, healthcare worker scarcity or lab test were creating problems, drug supply affected. All these phenomenon is basically COVID-19 medical crisis, what we can call it as. And it is not only affected the medically, but it is affected psychologically. It is affected socially. The manufacture sector is affected. The economy has gone into a problem. The movement of people across travel industry has gone into the shell. And a lot of policy and regulatory changes happened because of this particular COVID-19 issue. Now, when we look at the COVID-19 as a medical phenomenon, it's a respiratory illness, predominantly respiratory, some GI symptoms. Fever may be there in majority of the 88% of the cases. So these are the common symptoms. They look like influenza or flu. What is important is that many of the people are in panic situation that whether it is a positive or negative, and immediately we get surprised. Oh, I am positive, I am negative. We have to keep one important factor is that 85% of the people are going to have mild symptoms. It's a simple flu what we get. Around 10% of the people, they may be having some severe symptoms. And 5 people which are maybe having requiring classical hospitalization or ICU care kind of a thing. So we have to think that almost out of 10 corona patients, 9 patients are going to have a relatively milder disease. So this is a very, very important message we have to learn. The CDC, that is Center of Disease Control and Prevention, US, has identified which are the risk patients who have to be taken slightly more care. 65 years and above, then those who are basically bedridden people, especially paralysis, stroke, or some neurological condition. And there are certain medical conditions. If somebody has got a diabetes, or somebody has got a high blood pressure, suffering from heart disease or chronic lung disease or asthma, even severe obese people, and those who have either liver, kidney, because these are all are vital organs, and the immunocompromised patients taking a lot of medications. So all these are the people they have to look into that they should not come into contact of corona because the severity of the illness might be slightly on the higher side as compared to the other people at large. So here the all the people have to look into if I have got a diabetes, then definitely I have to take care more and I should not get corona. Otherwise, slightly my corona will be slightly more problematic than the others. And over a period of time, we have learned in the first wave that healthier way, and that healthier way will be a new normal, right? The health is going to be one of the very, very important component in our life, which was actually not there. Let us say nobody was thinking health as one of the very important element. But I think this is the in the century, this is the first bigger epidemic has shown is that the health is one of the very important critical phenomena. So this, all the facts we have already learned. There is no doubt about that. Hands washing and then the face covering, then the space, distancing, keeping ourselves at home. All these factors which we are already experienced, and these have to be continued till the time the whole corona episode is going to get over a period of time. The another important point is nutrition, because whatever we eat ultimately is going to help us in generating the good immunity. So we have to watch for our nutrition, what kind of food we are eating. And especially if you have got a cardiovascular or diabetes or hypertension prone, then we have to reduce the salt intake. We have to keep the limit the sugar intake, and as well as we have to limit the fat, because if you see the Indian population, they eat more carbohydrates and more fats and less of proteins. So overall, the ratio of carbohydrates, fats, and proteins in the diet is going to be very, very critical. And we also have to take supplementation if it is required. That is very critical now because for there are so many vitamins, vitamin C or vitamin D. They have got a good immunity benefit. Or if you talk about the mineral like zinc. So once we eat vegetables, fruits, I think some of the vitamin component or mineral component is also going to be come into our regular diet. But during this lockdown, what is the important phenomenon is people are stuck at home and the movement got affected. Once you go to office, once you go in the railways, you travel, you walk. But once the people have got locked down, automatically everybody's they have to stuck at 3 BHK, 2 BHK, 1 BHK flats, and it is going to be very, very difficult. And once you are at home, also the tendency to eat more is also there. So what is important is that how to cut short the calories. Everybody has to look into is that if you are eating 3 to 4 times, whenever you are eating, can you cut down the calories so that the number of calories which are going to be consumed in a day is going to be less, because caloric expenditure is reduced because of the lockdown, people staying at home 24/7, and the chance of exercise or chance of walking is going to be drastically reduced. So it is very important is that one should look at the number of meals. If you are taking 4 or 5 meals, can you make it 2 or 3? And if you are eating during the meals, how much less you can eat? That is another very important point. Most important element is immunity. The government also has given a lot of guidelines that what kind of substances in our daily food, as well as they also have got a immunity building power. So I think turmeric is one of the important point, or green tea, ginger, or even garlic, then honey. These are a lot of components in our food also. In the naturally they are present. They are immune boosting substances. So automatically it's better that you keep your immunity so that the severity of the infection is going to be very, very less. The next important point, as I told, the problem which we got after the COVID, once the patient started coming, everybody was gained a good amount of weight. And those who are diabetes or those who are already taking treatment, their whole glycemic control was lost, right? Because the food habit as well as the expenditure. So it is very essential is that one has to burn the calories also. And for burning the calories, the components which are going to be very, very critical is that how to keep the weight at proper during this particular period of time. There is one beautiful line that obesity runs in my family. The problem is that nobody runs in your family. And that means the exercise pattern is not there to that particular extent. And there is a new thought process is that in the office, that the sitting is considered now as a new smoking. So even half an hour of sitting is considering as one of the risk factor for cardiovascular illness, like smoking also. So after half an hour of sitting, one has to walk for 5 to 10 minutes. So that is a new normal which is there for all the lifestyle diseases. So what can be possible at the home, or at least in our surrounding area? Because of the lockdown, you can't go to a very large area. So at least try to engage oneself in the physical activity, whether it is 30 minutes walk, or if you are staying in the building, then at least staircase up and down also can be one of the exercise. And I think household chores, right? Because if you see our previous generation was so fit, and one of the reason for fitness was they used to do a lot of activities at home. And because of the lockdown, and we have got a maidless life, and the maids were not available, so everybody has to do the whole homework and that is definitely going to burn out the calories. And if it is possible, like cycling or some mat exercises which can be done at home, which is possible, that also can be looked into. This is a classical example. If you look at Mahatma Gandhi's stature, there is hardly any glucose available for storage. There is no fat deposit, and there are even less muscles. Now, what is the reason for? What is the secret of all these facts? The secret is that he is having two phenomena. One is walking and other is fasting. And these two techniques he used as a satyagraha also, right? So if as a satyagraha he was walking, and as a satyagraha he used to do a fast. Now it has been estimated that he has walked almost 79,000 kilometers in his lifestyle. That means around 10 to 15 kilometers per day. And he used to do 1 day fast, or eating only fruits on 1 day, or only milk, or 1 day, 2 day fast. And his highest fast was 21 days. So this is a way that this walking and fasting definitely can keep oneself fit during this particular COVID-19 pandemic and lockdown, because all the IT industry now is working from home. And all the other industries also, almost 50 to 60% people are working from home. In this particular situation is very critical that one has to maintain the weight which is there. And if it is really already high on the weight, then you have to try to reduce it, right? Don't allow weight gain. Because when I analyze my 100 patients which came after lockdown, after 2 to 3 months of lockdown, almost 70% of the people have gained weight. Clear? And then gaining weight, it is coming back, it is also very, very difficult during this particular period of time. The another important points which I have raised is the risk factors. Now, the high alcohol intake is one of the risk factors. There is one beautiful, interesting Facebook quote: "I only drink beer on the days that ends with Y." That means the person drinks daily, actually, because all the days that ends with Y only. And during this lockdown period, because of the stress component, the other activity is tobacco. All these things, there is a tendency to rise. So we have found the smoking increased in the young population because there is a digital fatigue. People are listening to the digital webinars as well as digital education at all sectors. So there is a stress. So, and overall emotional stress is also increased. So there is an increased tendency towards the cardiovascular risk factor. So one has to be very, very watchful that avoid tobacco in any form and try to reduce alcohol to the optimum extent. Now, coming to the important population, as I mentioned, is that about the whole population, whenever you feel like something different, if you have got a febrile illness or you are feeling that it is not fever, but any unusual symptom, definitely immediately approach the doctor. Don't wait and don't self-medicate. That is very, very critical. And checking, because the laboratories were not open at that particular period of time. The patients are afraid to go to the laboratories because of the people contact in the nearby. But if I am having hypertension, I have to measure the blood pressure. I have diabetes, I have to measure sugar in between. Otherwise, the sugar control is lost. We may realize after 6 months or after 1 year. So whatever disease may be, if somebody having thyroid, somebody is having dyslipidemia, somebody has cardiac illness, neurological problem, whatever the regular follow-ups are there, that follow-ups has to be done at the routine interval in the practice. So we have to maintain the goal. That is very, very essential, that these are the new normal. Like our fasting blood sugar has to be less than 125, or the sugar control HbA1c has to be less than 7%. The blood pressure has to be 140 by 90 and less. The cholesterol has to be less than 100. So these are the fitness criteria nowadays, these modern fitness criteria. And if you are already having particular disease, then I think it is very essential you have to keep medicines 2 to 3 months of stock, and you have to got good facility of online chemist, and you should take the same medications whatever the doctor is advising. And once you achieve the control pattern block, it is very essential is that almost 10% of the people, in spite of lockdown, staying at home, their diabetes was absolutely under control, their blood sugar was absolutely under control, and really we appreciated them by giving small certifications that you have maintained your all the vital parameters very well during this particular COVID-19 pandemic. Now, the all factors why I discuss is physical, but what is important is that if you look at the definition of wellness, the wellness has got multiple components. The wellness has got physical component, that is a basic component, but it also has got mental, intellectual, social, as well as spiritual. So when you talk about, it's a commonly word used, yeah, how are you? And we on the WhatsApp, I am well. But when you are well, you should be physically fit, you should be mentally fit, you should be intellectually fit, you should be socially fit, and you should be spiritually fit. That is very, very important. Once we casually use word as a well, it has got many, many important components. And the whole process of lockdown, what exactly has happened is that apart from the physical, the main component which triggered is basically mental component. The balancing act between work, office, home, children education, classes, all those factors basically that balance during this particular COVID, because if there is no balance, then the person will be emotionally disturbed, and the emotions are going to affect the overall scholastic performance, office performance, as well as there will be a problem in the stress. So one of the very important point what we realize in our practice as well as across the people is that there is increased amount of stress. And one of the feed for this particular stress was the news. The people were listening to the news of corona so much that this news, the data which is there now today we have got. So if you go on reading those data which is of negative, it is going to influence the people. And then their whole life has become into a trouble, right? So the one of the reason why I have written this emotional book is that all this emotional stress component what we have seen across, we took into different stories and try to put it as a positive note. So everybody has to do something for reducing the stress. Sleep is very important. Avoiding the tobacco, alcohol is very, very important. Some breathing exercises. If everybody has got at least one hobby, try to spend some time in the hobby. Somebody likes music, or somebody has got a sculpture, coloring, anything. Just spend half an hour daily. That is very, very important. And connecting with the people. Because when the person was going out, at that time he was connecting with office colleague, peers, and there is some interaction. But because of stuck at home and the work from home culture, the contacts are reduced. So what only important point is that you are also going on connecting the people who have got a positive mindset, right? If the opposite person also starts telling the same negative story of COVID, then you will be affected more. So that is very, very important. So persuade a hobby. This is a very, very important point. Right? There was a inside me. There was a writing spirit, and this whole COVID I utilized for writing spirit and came out with a book along with one of my colleagues, psychologists. Do meditation. That is very important because the highest component of wellness is spiritual component. One has to engage some time in a day